We're going to talk today about lateral elbow tendinopathy, sometimes called lateral epicondylitis. We're getting away from the itis because we know that this is prolonged kind of a tendinosis type damage. So my patient comes in and they have a chief complaint of lateral elbow pain here. And one of the first things I want to do is rule out the cervical spine because I don't want this to be referred from the cervical spine. So as a PT, this is how I would clear the cervical spine. So Megan, I want you to look over your right shoulder as far as you can, and I'm going to apply a little overpressure every time we do this. Can you go to the left? And I don't want any of these things to recreate Megan's symptoms. Can you look down towards your belly button? I'm going to give a little push. Thank you. And then look up towards the sky. Extension many times is the one that will recreate patients' symptoms because of their facet OA. Can you bring this ear to this shoulder? And I'm going to do 2 while I'm here. Okay, and then to the left. And let me know if any of this bothers you or recreates your left-sided elbow pain. Nothing? Great. Okay, so I feel like this is more local now and not referred. So I'm going to do 3 tests to rule in lateral elbow tendinopathy. The first one I'm going to do is a Cozen's test. So I'm going to bring your arm straight. You're going to bring up just like that. And I'm going to offer a little bit of resistance. So she has to use her wrist extensors to stabilize. This is called Cozen's test. So I'm going to push down, and that recreates your symptoms. That test has a sensitivity and specificity of 84% and 91% respectively. Now the next thing we're going to do is we're going to stretch those muscles. So when I do this, I want her elbow extended, wrist flexed, and I'm going to put her in a little bit of ulnar deviation so I can get not only ECRB but ECRL. So I'm going to passively do this, and this recreates your elbow pain. She says yes. The sensitivity and specificity of the Mills stretch are 53 and 100% respectively. Then the last thing I want to do is I want to differentiate between extensor carpi radialis longus, which goes to digit 2, and ECRB, which goes to digit 3. So we're going to do the Maudsley's test. So Megan, you're going to bring your arm out like this, and what I'm going to do is I'm going to resist digit 2, and I'm going to resist digit 3, and I'm going to ask her which one hurts the worst, and she said digit 3. So extensor carpi radialis brevis is many times the culprit. And the reason for that is it stabilizes our central column. So all of this activity we have to do at our wrist, we need our extensor carpi radialis brevis or ECRB to stabilize our central column. So the Maudsley test has a sensitivity and specificity of 88% and 66% respectively. Okay, so one of the things that we can do, and we know evidence supports this, is the use of a wrist brace. And it's a little confusing for patients because they say, my pain is here, why are you bracing my wrist? You have to explain that the tendons are getting overused distally when they stabilize. So many times we'll start with a wrist brace similar to this, or a wrist splint. Many people start by wearing it in the evening or at night only because they'll sleep like this and irritate those muscles, those tendons. So you can start by wearing it at night. If you really like it and feel like you can wear it during the day, then you're welcome to wear it during the day. The thing we have to be cognizant of is if you wear this during the day, we have to make sure you don't get pain in other joints from faulty mechanics. So many times we'll start at night. So that might be something we start with. I'll let you go ahead and slip that off. I know many people want to start with a tennis elbow brace. And instead of buying one of those for $30 or $35, I strongly encourage people to go to their local sporting goods store and buy pre-wrap. And what you can do instead is you can make your own tennis elbow strap to see if it's helpful. So Megan, I'm going to have you kind of straighten your arm out a little bit, and I'm going to take my pre-wrap and I'm going to go around her maybe 3 or 4 times, and she can decide how loose or tight she wants it, which is one of the nice things about the pre-wrap. And then what we're going to do is we're literally going to kind of roll it up and make a tennis elbow strap like this. There we go. And now she can try that. If it's something she likes, she can continue to use this. She can make it tighter. She can make it bigger. And so I encourage using this before I go out and buy a tennis elbow strap. Now, between this and the splint, I have people do an AB design. So maybe try one for a few days, try the other one for a few days, try them both and kind of figure out what works for you. So a very important component of managing the patient with lateral elbow tendinopathy is some strengthening exercises. And traditionally for tendinopathy, we always think about eccentrics. And research has shown, particularly in the upper extremity, it doesn't matter if it's eccentric, if it's concentric, if it's isometric, you just need to get them stronger. I don't like a TheraBand, and here is why. When my patient, Megan, is doing her wrist curls, what happens is when she comes up here at end range wrist extension, she has significant shortage through all of her wrist extensors there from a length tension perspective. So this closed grip can be problematic. So instead, my preference is to have them hold a ball or a sphere. You can do the same exercise with that, Megan. Or if they only have dumbbells at home, what I have them do is I have them wrap a towel or something around it to open up the grip a little bit. That tightened grip just doesn't work very well. So here Megan is doing an agonist reversal, so a concentric, eccentric. I can give her a heavier ball. And now Megan, what we're gonna do is we're gonna do an all eccentric exercise. So you're gonna have to use your other hand to lift up, and now it's going to be all eccentric lowering. Very good. So we call this up with 2, down with 1. So this would actually be an example of an eccentric exercise I would have my patient do. So Megan, the other thing that can help with this, because this is relatively superficial, is some sort of icing. What I encourage people to do, you can use an ice pack, but I do think at this small area, an ice cup actually works better. So you're gonna fill it full of water, freeze it, peel down the paper, and then you can do about 5 to 7 minutes of ice massage in that area to get that analgesic effect. Now you had asked a little bit about dry needling and corticosteroid injections and things like that. There is benefit to dry needling here, so that's something we can certainly do. Corticosteroid injections in the research did not fare any better than conservative care. So for a plan of care, I'd like to start with dry needling and just some conservative care. And if and only if we can't get you to turn the corner, would I consider corticosteroid injection.